Ms. Sudhamani, Saksham State Mahila Member, to present a bouquet to sir. Sudhamani. Chesa. Also might be joining us a little late. And the celebrity guest for today's program, Ms. Nabha Natish, also will be joining us shortly. I now request Dr. M. Srinivas Garu, President Sushenahealthfoundation, to please join us on the desk. Sir is a senior neonatologist, who has more than 25 years of experience in the field of pediatrics and neonatology. He has a passion to teach postgraduate staff nurses in neonatology. He has more than 150 publications to his name. So we're very happy to have you with us. I request Ms. Jayashwari Kumari, Department of Food Science of Chemistry, to present a floral welcome to sir. I request Dr. Bhavani Madam to present a bouquet to Mr. Subbaraj. I now request Dr. M. Kavita, Vice Principal, University College for Women, to please join us on the dais. I request Dr. to present a bouquet to our Vice President. I request Madhavi Garu to please extend a floral welcome to Kavita Madam. I once again welcome all of the dignitaries who have added a lot of glory to our dais today. We are custodians of very rich tradition of culture and heritage. We believe that any auspicious program is started by lighting of the lamp. We believe in the saying, Deepam Jyoti Paradharma. I now request all our dignitaries to mark an auspicious beginning by lighting the lamp. I request the dignitaries to wait for a minute. Our chief guest has arrived. She will also join us for the lighting. I request the dignitaries to proceed for lighting of the lamp. Our chief guest will join us. of Food Science to render our prayers for. Thank you, my dear for rendering such very prayer. With a great hope that this light, indicating upward movement, will guide us on the right path. We will move ahead with the program. It's indeed a great pleasure to have our chief guest of today's program, Srimati Karna Vakiti Garu, who is joining us. Ma'am, a hearty welcome on behalf of the entire India. I request Dr. Santosh Krishna, Head Department of Food and Nutrition, to extend a florid welcome to Madam. Madam is a senior IAS officer and a licensed director, and she is presently Commissioner of Family and Health Welfare. She had various challenging administrative roles in her career. She was chosen as Division Director for the Land Survey Program in 2017 by the Telangana government, knowing her abilities and strengths in getting things done. She is the winner of Chief Minister's Award for her commendable role as an administrator. We are extremely honored to have this dynamic lady amidst us today. Thank you so much for joining us, ma'am. I now request Professor Vijayalata ma'am, Principal, University College for Women, to make the welcome remarks.
Good morning, all. Students, good morning. Good morning. Thank you. So, it's a privilege and honor to be part of this program as Principal Women's College. I feel so honored to be here for this noble cause which has been done by Dhaatri Foundation and Sushenahealthfoundation Foundation. So, I welcome our Chief Guest, Srimati Karuna Vaketi, IAS Commission of Family and Health Welfare. Special invitee Sri Alluri Ananta Venkata Rangaraju Garu, Managing Director, CEO, NCC, and Mrs. Seema Pavaskar, CSR Head, Compton Greaves, Ms. Dr. A. Durga Prasad Garu, Advisor, Dhaatri Mother's Milk Bank and CLMC, and Dr. Srinivas Murki, President, Sushenahealth Foundation, and Dr. Santosh Kumar, Founder Director, Dhaatri Mother Milk Bank, General Secretary, Sushenahealth Foundation, and Dr. Subbaraj Garu. I welcome you all to this college, sir. This University College for Women is a constituent college of Osmania University with autonomous status since 1989. It is accredited with A grade by NAC and also has a CPE status, that is College with Potential for Excellence. And it has been established in the year 1924, and the college has strived for 93 years to empower women and achieve their goals. And I am confident that with this each year passing by, the college will rise the new heights and excellences, and the college will help the underprivileged and the students who are from rural background to come and study in this college and have an excellent exposure towards the education and move ahead with power of knowledge, character and confidence. Thank you very much.
Thank you so much, ma'am. We are sure that with able administrators like you, the college's flag will always be kept high. Thank you so much. I now request Dr. Santosh Kumar Kraleti Garu, Founder Director, Dhaatri Mothers Milk Bank, to make his opening remarks.
A very good morning to all the young and energetic future women power of Hyderabad, Telangana and India. A big round of applause for all the women who are here. And we have some of the ideologues and women achievers and who have been leaders in motherhood and also leaders in women welfare amongst us. And very privileged and honored to have Karuna Vakati Madam, who is the Commissioner of Health and Welfare, Family Welfare, here amongst us. In 2016, when we were working in an organization which was an international organization, we were talking about hand hygiene compliance, breastfeeding compliance, and such quality improvement initiatives. And we saw that sometimes there are gaps for which we do audits, but those gaps have to be met actually on ground. అప్పుడు మేము గమనించింది ఏంటి అని అంటే, మనము తల్లిపాలు తాగాలి, చేతులు కడుక్కోవాలి అని చెప్తూ ఉంటాం, కానీ చిన్నవి అప్పుడప్పుడు చేతులు కడుక్కోవడానికి అప్పుడప్పుడు వాటర్ ట్యాంక్లో వాటర్ ఉండదు, వాష్ బేసిన్ ఉండదు, ఇట్లాంటివి అవ్వచ్చు. సో ఇలాంటివి మన గ్రౌండ్ లెవెల్లో వచ్చి పనిచేయాలి అని చెప్పి 2016లో డాక్టర్ సత్యనారాయణ, డాక్టర్ శ్రీనివాస్ గౌడ్, myself, under the able guidance of Dr. Sudarshan Reddy sir, late Sudarshan Reddy sir, who's there with us here from the heaven, who's looking, and also with the guidance of Dr. Srinivas Murki sir, we started this foundation called sushenahealthfoundation. All three of us, we quit our jobs in 2016, and in 2017 we registered this as a society, and we started working. ఆ రోజు 2017లో ధాత్రి మదర్స్ మిల్క్ బ్యాంక్ నిలోఫర్ హాస్పిటల్లో స్టార్ట్ చేసినప్పుడు Karuna Vakati madam had supported us immensely in that inauguration, and she actually moved every stone and made it a grand success. Thank you, madam. And we know it was such a grand success, and it would not have been a grand success without the support of ma'am and also government of Telangana and Nilofer Hospital. Alage ee roju, this is also a very historical day that we are having a sangam of Ganga, Yamuna, Saraswati. On one side, NGO and doctors who are working in this area. On another side, education institutions who are looking after education how exactly and best we can match industry, jobs and then the education. And on the third front, we have huge confluence by Antarvahini, which is not seen. పని చేస్తారు కానీ అసలు కనబడరు బయటికి. అట్లాంటి ఇండస్ట్రీలో నుంచి మనకి సిఎస్ఆర్ హెల్ప్ చేసే రంగరాజ్ గారు అండ్ సీమా పవాస్కర్ గారు, దుర్గా ప్రసాద్ గారు, సుబ్బరాజ్ గారు, దే ఆర్ హెల్పింగ్ అస్ బట్ నెవర్ ఆన్ ద స్క్రీన్. చాలా మనం పూర్వం మనం ఈ చేయితో దానం ఇస్తే ఈ చేయికి తెలీదు అన్నట్టుగా ఆ విధంగా ధాత్రి మదర్స్ మిల్క్ బ్యాంక్ని సుమారుగా లాస్ట్ 5 years బట్టి ప్రతి సంవత్సరం మనకి సుమారుగా 30-35 లక్షల వరకు ఖర్చు అవుతున్న దాన్ని ఎంతోమంది ఇలాగా దానం ఇస్తున్న వల్లే అది ముందరికి వెళ్తోంది. అండ్ వీ థ్యాంక్ యూ ఆల్ ది సిఎస్ఆర్ డోనర్స్. వీటన్నిటితో పాటు వీ హ్యావ్ ఇమ్మెన్స్ support and blessings from government of Telangana, who has been supporting this endeavor. And of course madam will talk about how this initiative is going to be taken forward. But from Sushena's point of view and Dhaatri Mothers Milk Bank point of view, మేము చాలా అదృష్టవంతులము. ఎందుకంటే ఇలాంటి ఒక అమోఘమైన ఈ సంగమం ఏదైతే జరుగుతుందో ఆ సంగమంలో వీఆర్ జస్ట్ విట్నెసింగ్ హౌ బ్యూటిఫుల్లీ థింగ్స్ ఆర్ ట్రాన్స్ఫార్మింగ్ అండ్ హౌ హెల్త్ కేర్ ఇస్ బీయింగ్ ట్రాన్స్ఫార్మ్డ్ ఇన్ దిస్ కరెంట్ సిచ్యువేషన్. సో విత్ ద సపోర్ట్ ఆఫ్ ఆల్ ద పీపుల్, బ్లెస్సింగ్స్ ఆఫ్ ఆల్ ది good hearted people, this whole program is going forward. And in this initiative we welcome each and everyone to join hands, each and everyone to come together. తల్లి పాలు ముద్దు, డబ్బా పాలు వద్దు అన్న స్లోగన్తో మనం ముందరికి వెళ్తున్నాము. అలాగే ఈ తల్లి పాలు ముద్దు.
Believing in that, University College for Women Koti is entering into an MOU with Dhaatri Mothers Milk Bank. So now is the time to sign an MOU between Dhaatri Mothers Milk Bank and University College for Women. I request Vijilata ma'am and Dr. Santosh garu to please go ahead with the MOU signing. I also request Dr. Srinivas Murthy sir to please join in this event.
And also, when they come there, they have the feeling that apart from helping their own babies, they need to help the other babies whose mothers are not having adequate milk. So this helped us to develop not only milk bank, but other aspects of breastfeeding, kangaroo mother care, and other skin to skin contact, and family centered care or a mother centered care is what we learned from this milk bank project. And with that success, we got offers from other states to help them. We did help establishing milk bank in Indore and Bhopal, and that has been a success. We have trained the nurses or the milk bank staff there to conduct the milk banks in a more protocolized manner. Then after that, we are getting a lot of inquiries and a lot of requests to support or start milk banks in other parts of Telangana and also neighboring states. Very soon we are going to start a milk bank in Kakinada Medical College, and almost the work is on the process. So one aspect has been milk bank. Then we realized that we need to sustain the work, and to help us sustain the work, we have wonderful donors like Nagarjuna Constructions, Crompton, NDTD, and other people. Voluntarily they are coming and supporting. Some of the mothers who come to donate milk, they start donating money also and start supporting services also. They are doing voluntary services in Nilofar Hospital to help the babies and the mothers. So this is a positive thing, that when they are coming to do something else, they are doing more good to the babies and the mothers. So that has been the first goal, and we have achieved that. And we are hoping that with the onset of, or with the inauguration of today's ambulance-based milk bank. So what is this milk bank ambulance? It is an added advantage to what we have in Nilofar. So what we do in Nilofar is we collect the milk, we pasteurize, we ensure that there is no infection in that milk and give to the babies who desire. Now we know that many mothers are willing to donate, but they are not able to come to Nilafar. So how do we get that milk? So one method is by having the milk bank or ambulance-based milk bank. Our ambulance will go to the mother, collect the milk, pasteurize and give it to the babies. The other method is, lot of babies in city of Hyderabad are not able to get mother's milk when they are in the SNCUs or in the NICUs. So we need to link up with these NICUs as SNCUs where they are giving formula milk, and we want to replace all the formula milk with mother's milk. And that's our objective, and we hope that this ambulance is going to help us replace the formula milk with human milk in all the NICUs or the neonatal intensive care units of Hyderabad. And in that goal, we request Madam Karna Vakati Madam, because her heart is also in breastfeeding and nutrition of babies and infants. We request you to help us utilize the services equally in the government sector or more in the government sector too. And we are there, ma'am, to help as much as possible to support all the SNCUs in the state of Telangana. So one has been the milk bank, and then the milk ambulance came into picture. Then the other thing which we have started is we started a conference. Every year we are going to do a conference, the first South Asia conference, which focuses on milk, mother's health and preterm nutrition. So this we are going to do it in the month of November, and here we already have the world support, world leaders who are doing immense work on nutrition and preterm nutrition are part of the faculty, and that conference is going to organized in Hyderabad. So I request all of you to ensure that be part of that conference. It's both a hybrid conference, a virtual and physical conference. All the students who are here, part of
on the dais, off the dais, I can see a lot of future leaders sitting there, and my colleagues and friends. Thanks for giving me this opportunity to talk about Dhaatri Milk Bank. A lot has already been. 700 liters of milk to the needy babies, and 10,000 babies have been touched so far. So I think this is what we have done. So we have actually saved the lives of 10,000 babies in the last 4 years. And this is in the, all in the premises of Nilofer Hospital. So I think last but not the least, I would like to really thank, first of all, the Nilofer Hospital for providing us the space for doing this excellent work. This, I would say this is a God's work. And I would like all our donors here who are on the dais and off the dais. Actually, there are many other donors. Thank you so much for supporting us. So I would really like to, as Dr. Murki said, we want more and more encouragement, more and more people who voluntarily who can encourage other mothers to donate milk. That is more important. And I've got a message from Dr. Chandramodi Garu here. Mothers, mothers and would-be mothers, encourage one mother to feed the baby. I think one mother can encourage actually one mother. I think this will be really great. The word spreads, and then I think this will be a great initiative. Yes, so they're all future mothers, future leaders, and so I think please keep this in mind. Breastfeeding is the best for the baby. It is actually godliness to actually feed your own baby and donate milk. Thank you so much.
Thank you so much, Dr. Srinivas Murki Garu, Dr. Bhavani ma'am. I think 3 cheers to the entire team of Sushena Health Foundation and DMMB. Can we have a big round of applause for the commendable job that they have been doing and the impressive statistics. Thank you so much, ma'am. And the greatest thing is you're doing it with a lot of compassion and sympathy, which is a motivation for all of us to enter into this service. Thank you so much. I now request our special invitee, Mr. Alluri Ananta Venkata Rangaraju Garu, Managing Director, Nagarjuna Constructions, to address on, I think, I was told sir is Mithabashi, he doesn't like to talk much, only work. So Subbaraju Garu will be addressing us on his behalf.
Respected Dr. Srinivas, President of the Sushenahealthfoundation, and Dr. Santosh Kumar, General Secretary and also the Founder Director of Dhaatri, respected Principal of the University of Women's College, and today's Chief Commissioner of Healthcare and MD of NCC Limited, and Dr. Durga Prasad, past President of Institute of Cost and Accountants of India, and also an Independent Director of NCC Limited, and other dignitaries on the dais and off the dais. Today, it gives me an immense pleasure for inviting me and giving an opportunity to participate in this wonderful, greatest activity of providing mother's milk to the babies who are in need of that milk. Really, it gives me a surprise how the concept and the activity taken up by these doctors. Really, we should also appreciate them for taking up this a difficult and important activity, providing human milk for the babies who are in need of that milk. Really, there is no alternate food for the babies except the mother milk. If there is any alternate food, there is no alternate food except to the mother's breastfeed milk. So those newly born babies who are in need of that milk, how to make them, how to provide to them. No hospital, no medical alternate is there to provide that best food. It is called as amrutam. So bringing that milk and providing that milk to the needy babies, just months, days babies, months babies, how to, and saving the babies. And already we know there is a highest death rate in India, these newly born babies. So recognizing that activity and moving and collecting the milk wherever the surplus milk is there from the mothers and providing that milk to the needy babies is really a great activity. We should hands up to those doctors and those people who are behind this trust, the foundation and this function. So I appreciate and thankful to Dr. Durga Prasad, who is working as an independent director. While allocating the funds of NCC, CSR funds, he recommended for this good cause, noble cause, a donation to this institution. And I am personally thankful to our MD, Sri R. Rangaraj Garu, immediately donating the amount and give a support to this institution. Accordingly, last year, the company donated the amount, and current year also now donated for this special scheme today, what they are launching today. So we are there, NCC Limited is there, and it is NCC not only doing the business and also kept the social responsibility as an objective. And every year, our company is spending nearly 10 crores rupees on this social responsibility activities. You know that NCC, being a largest construction company, after in the listed entities, after the L&T, doing the projects across the India, and NCC indirectly serving the nation by completing various projects. So not only keeping the objective of profit earning and the social responsibility also kept by the company. And our MD, ఆయన మామూలుగా మాట్లాడరు బట్ ఎక్కువ చేస్తారు. So he immediately responded for this one and donated the amount. So NCC Limited taken up various social responsibility activities like rural housing to the poor people, and rural sanitation, and also adapted the schools, nearly 3 to 4 schools in and around the city, and we adopted the schools and providing the facilities to the poor people for the education. And also we have taken up a big project, construction of houses to the poor people. Nearly more than 100 people we provided the houses at a particular place in Andhra Pradesh. So they are all happy. So like that, NCC taken up various activities, and we have given the significant amount of donations to the recent Corona-19, to the Chief Minister Relief Fund to take up the relief measures. We have provided the ambulances for these COVID-19 victims. So like that, several activities the company has taken up. But among all those things, the activity what these doctors are doing is really appreciable, and the NCC certainly will support this activity whenever they need any funds for that activity. So we lastly appreciate the doctors, and also the today's activity of entering an MOU with the Women's College is a really good thing, and we are all happy in presence of all of us. We entered the MOU, so it has given a lot of happy. And lastly, I wish them and also pray the God to bless them to take the activity forward, to provide milk to more and more these needy babies, to save their lives, and it gives for their growth. There is no food, and what the immunity what it gives, no other food gives that type of immunity for growth and to the healthy of those babies. Thank you very much.
Thank you, Subbaraj garu. It has been your kind support which has brought this to this level. Now, actually this is a family gathering, because everyone is involved in this project. So I request that now the van inauguration is also there. So it's at 11:20, 22. So we have to be there, and before that the NCC. It's 11:37. Yeah. Because ముహూర్తం ఫిక్స్ చేసింది ఆయన. కాబట్టి అందుకని ఈ టైంలో మనం చేసుకోవాలి. ఈ లోపల ఎన్సీసీ వాళ్ళు కూడా రెడీగా ఉన్నారు మార్చ్ పాస్ట్ అది చేయడానికి. సో దాన్ని మనం టైం అడ్జస్ట్ చేసుకుంటూ ముందుకు వెళ్ళాలి. Now I request her to.
Thank you, sir. This is a sincere request to all the dignitaries to please briefly address the gathering, and we'll have to wind up this event and move ahead for the program. I now request Ms. Seema Pavaskar garu, CSR Head, Crompton Greaves, to address all of us.
Thank you very much for giving Crompton an opportunity to serve the community in need. As a corporate citizen, the least we can do is contribute our CSR funds for the best noble cause, and that's what we have done. We have, and we look forward for such more engagement. Thank you very much.
Seemaji has been very brief, but just I would like to make one point. NCC and many other donors were in Hyderabad. The Crompton people were in Mumbai. We don't know them. They never visited us. But then when we spoke about this, they have supported us. We really are very, very grateful to Crompton girls, and she has come all the way from Mumbai for this program, and big round of applause for Crompton.
Ma'am, thank you so much. We didn't know you traveled all the way to come here. You could have spoken for another 2 minutes. Anyway, it was briefly, we understood that you are fueling a great cause. Thank you so much. I now request Mr. A. Durga Prasad garu, Advisor Dhaatri Mothers Milk Bank, to address us.
A very good morning to you all. Madam Karunava Koti garu IAS, our MD, Mr. Rangaraj garu, other dignitaries of the dais and of the dais. I'll be very, very brief. When this invitation was sent to me, I said I'm not a part of NCC, even though I'm on the CSR committee, but I'm a part of Dhaatri. I just wanted to tell you how we can propagate this program. We brought Dr. Santosh Kumar to one of our family programs. Parasale, until one of the child was born and there was a function. And then it was thought that it would be befitting if he comes and then talks about mother's milk, especially breastfeeding. And that's how the idea kindled into me, and our committee board was magnanimous enough. We have started the first funding with just 3 lakh rupees. Then when we were looking at the activities, the way it was going, we thought that we should adopt this as a strategy. Madam, you are from Arya Janani. NCC has taken under CSR, under the health strategy, both Mother's Milk Bank and Arya Janani as its strategy for the health. And then I think we are supporting, we have already given a commitment for the next 3 years for these 2 programs, and we are associated with all other programs. Why I have given you the example of the family program is we have all here the future leaders and the future mothers. There is no function which you feel that you cannot involve this noble cause. Last 2 decades has seen a lot of things which were confined and considered to be very secretive and shy, like your your health pads. The day has to come that breastfeeding posters should be available at every pharmacy and every nursing home, and if possible, I come from Lions Club, we are trying to propagate this. That kind of a movement has to be taken. Recently we went with Honorable Governor. I've also made this comment, and I was told that UNICEF is one of the organizations which can help. Now that we have Madam who is the Commissioner for Health and Family Welfare, if Telangana government can begin this with Telangana, the moment, I think this day where we have signed MOU with Women's College and starting with one of the dream projects of Dhaatri would be very, very meaningful. With this small request, Madam, thank you very much for giving this opportunity. Thank you.
Thank you so much, sir. Thank you for all the support you have been giving this for this noble cause. So the huzz and buzz in the hall suddenly is because of the entry of our celebrity guest today. We heartily welcome Ms. Nabha Natish to this event, popularly known as Smart Beauty. She's here to add a lot of glamour to the event. On behalf of the entire fraternity of University College for Women, we extend you a hearty welcome. I request Dr. Deepika to present a flower bouquet to Ms. Nabha Natish. It's time for us to listen to our chief guest, Srimati Karuna Vaketi Garu. Ma'am, we request you to please address the gathering.
So good morning to all of you. It's a great pleasure to be here. Actually, it's pretty nostalgic time for me. As a research scholar, I was actually a visiting faculty in maths and statistics for Koti Women's College. So morning would be for research and afternoon would be for teaching the girls. I was in my early 20s, and so it's very nice to be back in the campus after a long time. I congratulate the Koti Women's College. All of us as students, the first time I was exposed to what the status of women or poverty, etc., was after I joined service. That's how much insulated the educational institutions are from what is happening in the country and development of the country. So it's very, very nice to see that young students and faculty are getting involved with actual action on the development of this country, and especially maternal health issues. So I congratulate the principal and also the faculty who had come to me and the health and nutrition department of the Koti Women's College. This is a very welcome step. Also congratulate the Sushenahealthfoundation Foundation, Dr. Santosh, Dr. Srinivas, Kashinath Garu. We've been associated with from the health department. Dr. Santosh in many ways has been, this is my second term as commissioner. The first term, his insights into healthcare did help me to gain knowledge on various aspects, not just maternal health. He's very passionate about a whole lot of other aspects of healthcare, and that's been very, very useful to me as a professional and personally. The Nilofer Milk Bank has played a very, very critical role in not just feeding 10,000 babies as was said earlier, but has also given us a policy level insight, and I am very happy to share that the Telangana government, we have decided to set up milk banks all across the state in all the 33 districts. About 10 are currently under construction, and we are going to make it functional. I am also happy to share with you and thankful to Dr. Srinivas, President of NNF, who's agreed to help us technically in pasteurizing the milk and also to train our personnel to handle it. So by saying this in the public space, I'm completely binding you, so you can't get out of this. So while we have made great strides, Telangana state law, after the state has been formed in the last 3 years, maternal mortality rate, I am very proud to say that maternal mortality rate dip has been the highest in the country. We have dropped by 17 points. So we are right behind, just behind Tamil Nadu. We are at 63, they are at 60. They have been working on public health for the last 15 years. But this very, very sharp drop has been because of the absolute commitment of our Honorable Chief Minister. We've had KCR kit, introduction of a whole lot of initiatives, standardization of labor rooms, mobile vehicles for pregnant women for their ANCs, and a whole lot of labor room practices, which has ensured that the maternal mortality rate drop has been the highest. Increase in public institutional deliveries, again Telangana stands #1 in the country. This is as per the latest SRS. However, NFHS 5 says that breastfeeding is at 37% in Telangana, so which is very, very counterintuitive, because you think the instinct of the mother is to feed the child, but somewhere something has happened and we have gone downhill. So this whole initiative of bringing out this whole concept of breast milk out in the open, talking about it, and this kind of initiatives, in my view, the milk bank is really the transformative intervention which will ensure that mother's milk and breast milk are propagated across the state and hopefully across the country. As Dr. Srinivas was saying, as we discussed today and as we've had discussions across the country somehow for various reasons, maybe C-sections, maybe the fact that mothers go out and work and a whole lot of other cultural and socio-economic issues, breast milk has been one thing which has been on the decline, and if we do not address this, we will not go very far in terms of the IMR, etc. So this is going to be, in my view, one transformational intervention from the side of all of us. So in this connection, I would like to thank the corporate sector. It's only when society in all its dimensions and aspects comes together that a real firm step is taken forward. So this constructive partnership between private commitment-driven individuals and professionals that Sushena has, and educational institutions and government, we will be able to move forward in a very, very constructive manner. From my side, from the government, we are all very passionately committed to maternal health, and we were just in the tribal areas about 1 week ago, and if you actually see the situation, you wonder if there is any development that has taken place at all. You see the Gutikoyas in deep forests, IMR, MMR are 3 times, 4 times what we have in the general areas. So we have a long way to go, but I think all of us together will definitely be able to achieve knowledge, commitment, compassion, and professionalism. All of us together, we should be able to make it. So I congratulate Sushena Foundation once again. I congratulate you, madam, for having this initiative in an educational institution, and I thank all of you for giving me this opportunity. Thank you.
Thank you so much for that inspirational words, ma'am. As a dedicated and committed bureaucrat, you've been doing your best, and that's an inspiration to all the young girls here today. Thank you so much. I now request Ms. Nabhanatesh to address the gathering here.
Hello everybody, how are we all doing today? Let's hear some noise. Can we? I'm really happy to be here, to be a part of such a noble event. As we all know, as a humans, and the basic thing is when we're just born is the nutrition, and for various reasons there has been deprivation in the natural breast milk in a lot of women, and it's very easy to reach out to bottled milk and get away with it, but it always has an long-term effect on a baby. But this initiative, which is taken by sushenahealthfoundation, is so appreciable. It is such a a noble gesture to have bottled breast milk and to make it reach to the needy and to reach to the babies who require it, that they have like a bright future. And I think I am really happy to be a part of such amazing event. And also it's such an amazing thing from the college side to make all the women and young girls aware of the importance of breast milk, so that in the future they bring the children to the country who will be strong and who will take our country, who are responsible to take our country forward. And you know that the youth are responsible to build the country stronger and take it higher. So now I was just given a couple of Telugu sentences, and I want you all to say it along with me. Talli paalu muddu, dabba paalu vaddu. One more time. Talli paalu muddu, dabba paalu vaddu. And say it to all your friends, all your who all you know, that this is been done for a cause. This is done for the growth of the country and growth of our children and the health of our children. Thank you so much.
Thank you, Ms. Nabhanatesh. We are pretty sure that it will directly enter into the minds when people like you address them. And it is so unusual of girls of women's college to not hoot or shout when she said, "How are you all?" Can we have a big round of applause or a shout and scream for the celebrity guest today?
Exactly.
Yeah, so unusual.
Did you have a glass of milk? Or just a green tea?
I think they're apprehensive of the dignitaries on the days. They will all also clap for you. You all can give a big round of energetic applause. So that's where you can add a lot of energy to the event. Thank you so much, Ms. Nabha. Now it's time to felicitate all our guests who have taken so much of time to be with us. I request our Principal Vijayalata ma'am and Dr. Santosh Garu, our Vice Principal Kavita ma'am and Dr. Srinivas Murki Garu to join in felicitating our guests. I hand over the felicitation session to Mr. Kasinath Garu.
Karuna Vakati Garu, వారు కమిషనర్ హెల్త్ అండ్ ఫ్యామిలీ వెల్ఫేర్ డిపార్ట్మెంట్, వారిని సన్మానం చేయాల్సిందిగా ప్రార్థిస్తున్నాను. అలాగే అల్లూరి వెంకట రంగరాజు గారిని కూడా సన్మానించవలసిందిగా కోరుతున్నాను. సీమా పవాస్కర్ గారికి నెక్స్ట్. సీమా పవాస్కర్ గారికి దుర్గా ప్రసాద్ గారికి నెక్స్ట్ నాభా నటేష్ గారు. నభా నటేష్ గారికి సుబ్బరాజు గారికి నభా నటేష్ గారికి చప్పట్లు కొట్టాలి. విజిల్స్ అయ్యారా మీరు? విజిల్స్ విజిల్స్. నెక్స్ట్ సుషేనా హెల్త్ ఫౌండేషన్ తరఫు నుంచి ప్రిన్సిపాల్ గారు డాక్టర్ విద్యుల్లత గారికి సన్మానం చేయవలసిందిగా కోరుతున్నాను. ఎందుకంటే ఆవిడ ఎంకరేజ్మెంట్ తోటి ఈ రోజున ఈ అగ్రిమెంట్ జరిగింది. వెల్స్ ఫార్గోది నేను మొమెంటో చదువుతాను. Wells Fargo, we are really grateful to them because they supported us for the last 4 years. This memento is presented by Sushena Health Foundation and Neelofer Hospital to the team Wells Fargo. It is a token of gratitude on behalf of thousands of mothers, neonates and infants who had received pasteurized donor human milk and counseling. Your benevolence and support have made a difference in the lives of thousands of babies. Dhaatri Mothers Milk Bank and CLMC has been transformed into a reality because of your continuous succor and aid. Dhaatri is now a model comprehensive lactation management center for providing guidance in setting up new mothers milk banks in Bharat. We thank Team Wells Fargo for benevolent CSR support for the past 4 years on this day, Thursday, 16th September 2021, during the program of launch of Dhaatri Mobile Mothers Milk Bank at University College for Women, Koti, Hyderabad, in collaboration with Department of Food and Nutrition, Department of Chemistry, Food Science, University College for Women, Koti, Hyderabad. Thank you very much. They are online, so they'll be watching this. We really heartfelt thanks to them. No, doctor. I request the Vice Principal to be felicitated by Sushena, President and Secretary. And I recognize the presence of some dignitaries here. Dr. Malati Shamal garu, Director, Vemana Yaga Research Institute. So, Tarvata Vijay Lakshmi Traleti, సంతోష్ గారి మదర్, ఆవిడ బికాజ్ ఆఫ్ హర్ సపోర్ట్. డాక్టర్ అనుపమ గారు ఆర్యజనని అనే ప్రోగ్రాం గురించి ఆవిడ చాలా కృషి చేస్తున్నారు. డాక్టర్ బసవరాజ్ గారు ఏఎఫ్ఎంసి గురుషవర్ హాస్పిటల్లో పనిచేస్తున్నారు, వారు కూడా నియోనాటాలజిస్ట్. డాక్టర్ తేజు ఓలేటి నియోనాటాలజిస్ట్, ఫెర్నాండెస్ హాస్పిటల్. రవికిషోర్ గారు ఇక్కడ లేరు, అక్కడికి వెళ్ళారు. డాక్టర్ చంద్రమౌళి గారు, వారు కూడా నియోనాటాలజిస్ట్, పీడియాట్రిషియన్, విజయమేరీ హాస్పిటల్. సుధామణి గారు వారు సక్షం అనే వికలాంగుల కోసం పనిచేసే జాతీయ సంస్థకి స్టేట్ మహిళా ఇన్ఛార్జి ఉన్నారు. వారు రాఘవేంద్ర గారు, మా ఏ ప్రోగ్రాం జరిగినా ఇట్లాంటి ముందు రండి, మీరు అక్కడ రాఘవేంద్ర గారు పువ్వుల్లో దారంలాగా కనిపించకుండా ఇవన్నీ జరిగేందుకు చాలా హెల్ప్ చేస్తుంటారు. మాకు నేషనల్ లెవెల్ కమ్యూనికేషన్ కోఆర్డినేటర్ వారు. Now I request Vice Principal to give vote of thanks, then we'll move to the venue.
I deem it a great honor and privilege to propose the vote of thanks on this memorable occasion. Let me first of all start by giving glory to the Almighty God for making today's occasion a resounding success. First and foremost, I thank our chief guest, Srimati Karuna Vakati Garu, Commissioner of Family and Health Welfare, for gracing the occasion despite of her busy schedule. My heartfelt thanks to Mr. Alluri Ananta Venkataranga Raj Garu, Managing Director, CEO Nagarjuna Constructions Limited, and we are grateful to Ms. Seema Pavarkar, CSR Head, Crompton Greaves. I thank our well-wisher, Academic Council Member, Mr. A. Durga Prasad Garu, Advisor Dhaatri Mothers Milk Bank. My heartfelt thanks to Dr. Srinivas Murki, President, and Dr. Bhavani Kalvapalli Garu, Vice President, sushenahealth Foundation. I thank Ms. Nabha Natesh for gracing the occasion. I am very much thankful to Dr. Santosh Kumar Karleti, Founder, Director, Dhaatri Mothers Milk Bank. I thank Subbaraju Garu for gracing the occasion. I thank our Principal, Professor M. Vijulata, for her unstinted support for the program. My heartfelt thanks to Department of Food and Nutrition and Food Science Department of Chemistry for their contribution. I thank all the distinguished guests, invitees present here. I owe special gratitude to Sushena Foundation, and I thank all non-teaching staff who have worked hard for this occasion. Special thanks to our PRO, Mr. Krishnaji Rao sir. I thank the members of the media for covering the event and all good hearts who work behind the screen. I thank you all.
జస్ట్ గెస్ట్ అందరూ ఒక్క నిమిషం ఇక్కడ నిలబడితే కానీ వాళ్ళు ఫోటో తీసుకుంటారు. ఒకే ఒక్క 20 seconds మీరు క్విక్గా ఒక్క ఫోటో సెషన్.
నేను మాట్లాడతాను. వెళ్ళండి సార్ ప్లీజ్. సరే. I thank Mr. Kashinath Garu and Ms. Jaya Garu for hosting the Jyoti Garu for hosting the program.
అందరూ వ్యాన్ ఇనాగరేషన్ కి రావాలి. దర్బార్ హాల్, యూ హావ్ టు రీచ్ దర్బార్ హాల్ ఇమ్మీడియట్లీ ప్లీజ్. అండ్ వీ హ్యావ్ స్వీట్స్ అండ్ snacks also there for you. Please come.
మహారాజన్న కొంచెం బ్యాక్ ఉండు కొంచెం బ్యాక్ ఉండు
అందరూ చక్కగా అలా
अभिदिष्टमृतन्यतः अथरे सन्तुषक्रमः इन्द्रलोकः तिष्ठ अपाश्रेत्राणि सञ्जयन् इन्द्रयेन मदेतरद ध्रुवं ध्रुवेण हविषा तस्मै देवाभिब्रमन् अयं च ब्रह्मणस्पतिः ॐ ध्रुवं देवानावरणा ध्रुवं देवो बृहस्पतिः ध्रुवं गजन्नश्चाग्निश्चरास्त्रं धारयतां ध्रुवो
సార్ ఒక్కసారి మీ బ్యాక్ సార్ సార్ మీరు ఒక్కసారి ఫ్రేమ్ కోసం సార్ ప్లీజ్ ఓకే సార్ ఉంది మేడం చూద్దాం షార్ట్ తీసుకో విద్యాబలం దైవబలం తదేవ లక్ష్మీ భవేత్ దేవం స్మరామి
राष्ट्रं धारयतां ध्रुवो ध्रुवेण हविषा तस्मै देवाभिब्रमन् ॐ ध्रुवं ते राजा वरुणा ध्रुवं देवो बृहः सर्वदैवाभिजातिः इन्द्रयमेह ध्रुवस्तिष्ठा राष्ट्रमधानय अभिदिष्टमदन् एतावन्तो वै देवानागुं समाः तदेवास्मै सवान् प्रयच्छन्ति तयेनं देवलग्नं गुरुनं तदेव ताराबलं चन्द्रबलं तदेव दिव्याबलं दैवबलं तदेव लक्ष्मीबलं भरामि चन्द्रबलं तदेव विद्याबलं दैवबलं तदेव लक्ष्मीपदेन्द्रयुगं दुरता
मैम लिखे लिखे मैम लिखे लिखे मैम थैंक यू So she's a pediatrician, she's keen. She's already doing this job. Yes, yes. Okay.
బయట ఫోటో తీస్తున్నారు మనదా
నేను వచ్చేదా జాయిన్ జాయిన్ అవ్వండి సార్ జాయిన్ అవ్వండి సార్ రెడీ రెడీ సార్ యా రెడీ రెడీ
తల్లి పాలు ముద్దు తల్లి పాలు ముద్దు తల్లి పాలు ముద్దు డబ్బా పాలు వద్దు తల్లి పాలు వద్దు
దగ్గర